So, on my own dime, I flew to Washington, and I was the keynote speaker at a congressional dinner. Dozens of congressmen there. I presented this. I said, so here's the way I figure this out when I read the rest of this, is come January 1st, 2013, when I walk in a room to see a patient with my assistant, she's going to have a little handheld computer device. When I make that diagnosis, she types in the code and it goes to the National Coordinator's office. While we're still in the room, the protocol is going to come back and how I'm supposed to treat that patient, A, B, and C. Now I'll have over 30 years experience doing this by then. I go, let's say it comes back and I have to do A, and I know A is not going to work, and I do B. I go, are you telling me that I'm going to get fined, that I'll get paid $20 and you're going to fine me $100? And they looked at me and they go, no, you're not going to feel that. You're going to get fined $100,000 in your first offense. I go, okay, well, you guys know me well enough. I'm going to do what's right for the patient, so I'm going to have to win the lottery in the meantime, and I'll send you that $100,000 check. I go, the next patient that comes in, I do the same thing because I'm going to do what's right for that patient. Are you going to tell me that I'm going to get fined a second time for that $100,000? No. They looked at me, I kid you not, and they said, second offense, you'll go to jail. I laughed. Nobody else laughed. There was a recent study done in the New England Journal of Medicine that come when the protocols kick in January 1st, 2013. 46% of currently active physicians will step aside. And I'm one of them. And here's why. 29 years ago, I raised my hand and I took an oath to do no harm. I've lived that oath 24 hours a day, 7 days a week. And come January 1st, 2013, I'm going to be put in a room and told I have to lie to the very people I've taken care of. All these years. I will not do that. And 46% of other treating physicians won't do it either. And my guess is that's a low ball estimate. I think it's going to be close to 60%. So, take a guess what I did. I went back to 1993 and I said, well, let's do the flow diagram. Because I sat down with Obamacare and we flow diagrammed it out. Here it is. Here it is. Obamacare creates 159 new federal agencies. 159. Over double the amount Hillary Care did. Here's the Comparative Effectiveness Research Rationing Board. In the main health care bill that followed in March, they created an entire center for the Comparative Effectiveness Council. And they called it the Center for Comparative Effectiveness Research. Well, here's an interesting thing that happened last night. I got a call from Washington, and they go, hey, Dave, we want you to know that you're making quite an impact on the Obama administration. They have actually renamed the Center for Comparative Effectiveness Research in honor of you because the press started asking them questions about comparative effectiveness, and they've renamed it, this is as of last night, the Patient-Oriented Outcomes Research Center. It's the same thing. It has the same director, everything's the same, they just changed the name in the bulletin. So remember we had patients down at the bottom of Hillary Care? Wait a minute, where are we here? Oh, here we are. And where were the providers? They're over here. And in between providers and patients are 159 new federal agencies looking out for your best interests. Remember we said the big problem in healthcare and cost is administration. We didn't get less of it. We got more of it. And it's going to cost less? It's going to be more efficient? The heart, the soul, the core of Obamacare is the rationing and denying of care. And many people find offense with this. Well, if that's the case, then why in God's name did they create the Federal Coordinating Council for Comparative Effectiveness Research, a rationing board, if it's not about rationing care? And if that's not the case, why did they create that center in the health care bill for the Comparative Effectiveness Council? Obama has said, well, 32 million new patients will be added to the system. Okay, if you have the same number of providers and you add 32 million more people to the system, how do you not ration care? But it gets worse. If there are 46% fewer providers and you got 32 million more people, how do you not ration care? If this isn't about rationing care, when they talk about how they're going to pay for this monstrosity, they're going to cut Medicare by $500 billion over 10 years. But the demographics of this country say in 10 years, we're going to have 30% more people on Medicare. 30% more people. $500 billion fewer dollars. It's about rationing and denying care. There's no facts. It's just hard numbers. I read every version. I read the House version, I don't know, 3 or 4 House versions, the 4 or 5 Senate versions, the final version. And here's an interesting thing. If this isn't about ration care, they created this Health Benefits Advisory Committee where this federal panel is going to oversee exactly what could be covered and what couldn't be covered. And it was in every bill. But it's interesting. In every single bill, it said that this Health Benefits Advisory Committee would not be involved in rationing care. Except the last version. That was the one sentence that was removed. And what was the administration's response to me finding that? You know, Dave, you're being kind of nitpicky. What? It rations and denies care to cut costs. The plan costs $1.2 trillion minimum. It creates 159 new federal agencies. It creates the Health Insurance Rate Authority, which is a direct violation of states' rights. It creates the Health Insurance Exchange. We can thank Harry Reid for this one. He said, well, we're going to create this exchange so we can create some competition amongst some of the insurance companies that are involved in this program. Well, guess what? They already have it in the federal government. It's called the Federal Employee Health Benefit Program. The problem is Harry didn't look at the analysis from the Government Accounting Office before they put this in. Because what the Government Accounting Office concluded was that that health insurance exchange was 89% less efficient than standard private programs. 89% less efficient. And then they said in their concluding sentence that this exchange was found to be, quote, highly vulnerable to fraud and abuse. Now, isn't that a wonderful thing to have involved? In addition, Obamacare establishes, their terms not mine, a comprehensive database on Americans, establishes individual employer mandates. In other words, if you, the individual, do not have health insurance, you will be fined $1,000. Or 2.5% of household income, whichever is greater. Now, it's interesting because in one of the other versions, it says that if you don't pay the fine, you can go to jail. The good news is that was taken out. The bad news is that if you don't pay the $1,000 or the 2.5% of household income, you'll be fined over $20,000 as a secondary fine for not paying the first fine. But you know what? We're going to say, you know what? Fine me, right? I mean, who's going to enforce it? By the way, to help pay for it, in addition to the $500 billion in cutting Medicare, they're going to impose $748 billion in new taxes. And of those $748 billion, 136 billion of which are going to be taxes on families making less than $250,000. Why do I say $250,000? Because Obama said during the campaign he wouldn't raise taxes on folks making $250,000 or less. By the way, as we all know in this discussion now about tax breaks and the Bush tax cuts, a big chunk of that group that's in the 250,000 are small businesses, the single greatest provider of jobs in this country. You run a small business like we have with our practice, how do you hire anybody? I mean, they want to know why unemployment is going up and not down. I can tell you in our office, we're afraid because we look at this and we go, holy cow. I mean, we're lucky if we potentially can afford to keep our employees the way it is with this just coming on board, let alone hiring more people. And the people in Washington are kind of like, well, we don't understand why people aren't hiring. Oh, come on. Get real. Cuts Medicare by $500 billion. We talked about that. It ends the Medicare Advantage program. Okay, no. Why is this important? Over 3 million senior citizens get care through Medicare Advantage as opposed to Medigap programs. Medicare Advantage programs are more cost-effective and they provide better benefits. Obamacare gets rid of the Medicare Advantage program. Why? That makes no sense. It's something that works. Because the alternative is Medigap. And this will shove millions of people into Medigap insurance. Why is that important? Well, first of all, it costs more. Second of all, the benefits aren't as good. But guess what? Let's turn to AARP. The single greatest funding source from AARP is not membership. It is insurance, their insurance product. And guess what? AARP is the single greatest provider of Medigap insurance. The reason why AARP signed on to this program is because people will be shoved out of Medicare Advantage and right into their arms. Follow the money. Obamacare increases the Medicare payroll tax by 30%. It increases unfunded mandates to states by billions, just what we need in this state. It increases funding to the IRS by $10 billion to hire 16,000 new federal agents to impose the law. That's who's going to impose the fines. His own chair of his Council of Economic Advisor, Christina Romer, who just stepped down, said, and it's a wonder why she stepped down, she said, you know, if you do these mandate things where you're going to force people to have to have this insurance thing and you're going to fine them, 5.5 million more people are going to become unemployed. Yeah, she couldn't last there much longer. So we got our coordinating council, for comparative effectiveness research. We got their nice little center that was renamed last night. We have the Health Benefits Advisory Committee where they removed the whole thing about rationing. We got Harry Reid's Health Exchange, you know, the fraud and abuse deal. We got the Health Choices Administrator that's going to oversee this. I mean, Harry Reid, if he gets voted out of office, guess who's going to be this? Right? We have the National Center, the National Coordinator's Office where we have to send off all our computer programs. Here's an interesting thing, and I wrote about this on Big Government. A lot of folks say, oh, come on, about the rationing. They're probably not going to implement that. Come on, Dave. Well, here's the interesting thing. They already have.